All right, so this is the spiel that I give every patient when they come to me for a consultation to get a vasectomy. So this is what you'll hear me say if you come to the office, but if you want a preview, you can watch this video beforehand. So with the vasectomy, the most important thing before deciding to get a vasectomy is to be 100% sure that you never want to have kids again in the future. Because while a vasectomy reversal technically does exist, it costs about $10,000 out of pocket, and the insurance doesn't help cover it at all. And the vasectomy reversal also is not always successful. So you really don't want to put yourself in a situation where you're going to be wanting to get a vasectomy reversal in the future. You should only be getting a vasectomy if you're 100% sure that there's no circumstance where you would want to get a reversal. Once you're 100% sure, then the vasectomy is a great option for sterility. So the procedure typically takes about 20 minutes. It's usually done in the office with the patient wide awake, and you typically drive yourself home afterwards, so you don't even need a ride. So in terms of the procedure itself, we start by numbing the skin. So we take a tiny needle and put the needle into the skin in the scrotum, right in the middle, and inject the numbing medication. So that's probably the most painful part, right? The needle going into the skin, and then the medicine burns a little bit. But then after that, you don't feel anything sharp. You still feel the pressure of somebody kind of tugging, but it shouldn't be really pain. So most people describe it as about a 20-minute experience of discomfort, but nobody's in the office screaming in pain or anything like that. So once the skin is numb, we make a tiny opening in the skin, an incision that's typically about 1 centimeter, less than half an inch. And through that incision, I will grab the right vas deferens and dissect it free from the connective tissue, and then cut out a tiny piece from the vas deferens to send to the lab. I'll then tie off the two ends of the vas deferens on the right side, and then I will grab the left vas deferens using that same midline incision. And then I'll do the same thing, dissect it free, cut out a tiny piece to send to the lab, and tie off the two ends. I'll then close the skin with some absorbable stitches, and you go home the same day. After the procedure, there's typically some pain that can be controlled with ibuprofen, Tylenol, and ice. We pretty much never have to give anybody opioid pain medications, and the pain typically lasts for a few days, so typically after that you can go back to a desk job. After about a week, most people feel back to normal. You can go back to having sex, but you still have to use birth control until we get the semen analysis a few months later. Once you have that semen analysis showing that there's no more swimmers, then you're good to stop using birth control, and everything goes back to normal. This procedure does not affect your hormones, does not affect your erections, the sensation, orgasm, ejaculation, all looks and feels the same. It's just under the microscope, there's no swimmers. So that's how it goes over 95% of the time, but it is a procedure, and every procedure has some risks. So the first risk, anytime we make a cut or incision on the skin, is a risk of a wound healing problem like an infection. Now if you're not diabetic and you're not a smoker, that risk is less than 1%, but it's never zero. Risk of bleeding or blood building up underneath the skin after the procedure, called a hematoma, it's about 1%. If that happens, typically we just need ice and pressure to get it to stop. It would be extremely, extremely rare that we have to take somebody back for another procedure to find something bleeding to make it stop. It's never happened to me, but it's technically possible. Risk of injuring either testicle, again, is extremely rare, but technically possible. The risk of persistent pain is about 2%. So about 2% of guys after a vasectomy will say that months or even years later they have this achy pain on one or both sides. Now, some component of that is psychological or related to pelvic floor dysfunction, but it's still real and we have to deal with it, and that's about a 2% risk. The other risk is when we do the semen analysis at about 3 months, sometimes there's still some swimmers left behind. If that happens, then it typically just means we need to give more time for the tubes to flush out. So that's why when we do the procedure, we send a tiny piece of the tube to the lab so that the pathologist can look at it under the microscope and confirm that we got a clean cut of the vas deferens on each side. There may be up to 1% risk that the pathologist says on one or both sides. They can't say for sure. And if that happens and the semen analysis is still showing swimmers, then you might have to have the procedure done again. Again, extremely rare, but technically it's possible. Then once you have that semen analysis showing that there's no more swimmers, the chances that those tubes ever reconnect is less than 1 in 1,000, but it's not 0. It has happened before that those tubes can find a way to reconnect on their own and you can get somebody pregnant. Now that's rare enough that we don't recommend retesting the semen analysis, but if you're nervous about it and want to get it retested, that's easy to do. It's not a big deal. So that's basically how the procedure goes, and over 90% of them we do in the office. If there are some people that have a lot of pain or anxiety or some type of obesity that makes the exam very difficult, we can do it in a surgical center under some type of sedation or even general anesthesia if needed, but it's not typically needed in over 90% of the cases. So that's the vasectomy procedure, and let us know if you have any questions.